Okay, let's dive into something that sounds pretty complicated: congenital UPJ obstruction. But here's the thing, it's actually one of the most common issues found in a baby's urinary system. In this explainer, we're going to break it all down, starting with a pretty simple question. So imagine you're building a brand new house, and before the walls are even up, an inspector comes in, takes a look, and spots a little plumbing issue, giving you a ton of time to plan a fix. That'd be amazing, right? Well, that's a perfect way to think about congenital UPJ obstruction. It's basically a blockage in a baby's own internal plumbing. And what's so incredible is that doctors often find it during routine checks long before the baby is even born. All right, so let's start with the basics. What exactly is this blockage? And, why does it even happen in the first place? So, UPJ stands for ureteropelvic junction. It's just the fancy name for the exact spot where the kidney connects to the ureter, which is the tiny tube that carries urine down to the bladder. An obstruction right there is just like a kink in a garden hose. You know what happens? The water backs up and the hose starts to bulge. Well, in this case, the kidney starts to swell. Now, this isn't something that develops later on. It's congenital, which means a baby is born with it. So what's actually causing that little kink to be there from the very beginning? Well, it usually comes down to one of two things. The first is that a little section of that ureter tube is just naturally too narrow. The other common cause is external pressure. Sometimes a blood vessel is just in a slightly off spot and it ends up crossing over the ureter and squeezing it shut. So now that we know what it is, how do doctors actually find it? Let's take a look at the signs. Okay, now this right here is probably the single most important and honestly the most reassuring thing for any parent to hear. Most babies with UPJ obstruction show absolutely no symptoms at all. But if symptoms do pop up, they make perfect sense when you think about that urine backup. That swollen kidney can sometimes be felt as a little lump or mass in the baby's belly. All that stagnant urine can also lead to urinary tract infections, or UTIs. And in older kids, it might show up as pain in their side or even lead to kidney stones. So, this brings us to the diagnostic journey. And because it's so often asymptomatic, the process of actually finding and confirming UPJ obstruction is incredibly important. And this is where modern prenatal care is just amazing. The vast majority of these cases are first picked up during a totally routine ultrasound while the baby is still in the womb. The technician will just notice that one of the kidneys looks a little swollen, a condition called hydronephrosis. The path to a diagnosis is really methodical. It all starts with that prenatal ultrasound picking up the kidney swelling. Then, after the baby's born, the next big step is a special kidney scan called a DTPA scan. This test is so important because it does two things. It confirms there's a blockage, and it tells doctors exactly how well that kidney is working. For almost everyone, that's all that's needed. So once the diagnosis is confirmed, the big question is, what do you do about it? And this is where things split into two very different paths. It's really a fork in the road. For a lot of babies, if their kidney is still working pretty well and they're not having any problems like UTIs, the best thing to do is just watch and wait. Doctors will keep a close eye on things with regular ultrasounds. The other path, of course, is surgery. And that becomes the right choice if tests start to show the kidney's function is getting worse, or if the child is having pain or infections. And this isn't just a guess. There's a really specific number that helps make that decision. That DTPA scan measures something called differential function, which is just how much of the work each kidney is doing. If the blocked kidney drops below doing 40% of the total work, that's a pretty clear sign that it's time to step in with surgery to prevent any long-term damage. So if surgery ends up being the answer, what does that actually involve? Let's take a look at how surgeons get things flowing again. The absolute gold standard procedure is called a pyeloplasty. And the idea is actually really straightforward. The surgeon goes in, removes that narrow, blocked little piece of the ureter, and then carefully reattaches the healthy part of the tube back to the kidney. It completely gets rid of the kink and creates a nice, wide open path for urine to flow just like it should. Now, this pyeloplasty surgery can be done in a couple of ways, and the choice really comes down to the child's age. For the littlest kids, so infants under 2, the traditional open surgery is still considered the gold standard. But for kids over 2, surgeons often use a laparoscopic or robot-assisted method. It's minimally invasive and just uses a few tiny incisions. Now, pyeloplasty is definitely the main solution, but it's good to know there are a few other less common techniques out there. These are called endoscopic options. Instead of removing the blockage, these techniques try to open it up from the inside. A surgeon might make a tiny cut over the blockage, or use a special balloon to stretch the narrow spot, or even place a little tube called a stent to hold it open. But again, these are generally saved for very specific situations.